So with our core strength, how can it influence our back pain? So from a logical point of view, we've spoken this week about the back. We've spoken about if we have poor posture, the impact that can have on our backs, and we've spoken about flexibility and how that affects our back. And obviously we know the different structures that we have in our spine that can cause pain or discomfort. So today's topic is all about core strength, and probably the biggest thing is understanding what we perceive as core strength and what other people perceive as core strength. So from a core strength point of view, I'm not so bothered about what your six packs look like. If you feel that you've got all the rippled flat stomach, what we're after from a core strength point of view is your support mechanisms. So if you think about your back and your body and your muscles as your big muscles that cover your skeleton, so they're the ones that move you. So your back muscles bend you backwards, your oblique muscles move you sideways, your six-pack muscles move you this way. If you take those away and you look at the structure muscles that support you, you're left with the top end of your core. So if I just take a couple of steps back again, you're left with the top end of your core here, which would comprise your diaphragm. So obviously sits under your lungs and attached to the lower end of your rib cage. You're looking at your transversus muscle, which is your muscle that goes across the stomach here, and it works like a bit of a corset, and it's the deepest layer of your stomach muscle, and that supports the front end of it. The bottom end of it would be your perineum, so that would be all your pelvic floor muscles. And then the back here would be your small muscles in your spine, which come across 2 or 3 vertebrae, and they're called your multifidus muscle. And then some people incorporate things like your fascia, so your thoracolumbar fascia, which then covers all of those on top. So what we're looking at is the structure that is that sort of center, which is your support. Okay. Now you use your six-pack muscle to curl. You use your back muscle to bend and pull backwards. Now, your six-pack muscle, as you're leaning backwards, is controlling that movement. As you curl forwards and you're coming up into a crunch, your back muscles are paying out. They're controlling that movement. Same with your hamstrings. When you're leaning this way and you're using your side bend muscles, so that would be your obliques on this side, your quadratus lumborum on this side, the muscles on this side control the movement. They start the movement to bring you back, and these muscles control the movement to let you hold. Now, the muscles that are deep to that, which are your postural muscles, so your deep core muscles, these are the ones that are basically giving you that support. Otherwise you'd sort of wobble all over the place. So if I'm bending side to side here, I want my core muscles to keep me nice and stable, so as I move, I'm moving as if I'm between 2 panes of glass. Now if my muscles at the front are a little bit more stronger, I'm going to curl forwards. If my muscles at the back are a little bit stronger, a bit tighter, I'm going to end up backwards. So the core from a point of view of this masterclass is really your support and your posture section, deep to all these big muscles that then move you. Okay. Now we've obviously talked about the structures that can feel pain. And they can be obviously all of the structures around your spine and the outer third of the disc. So all of those have pain nerve endings in them. So if we hurt them, we can press them, there's inflammation there, they will be sensitized and we'll feel pain. Once we feel pain, if we've been in pain for a while, the muscles that support us stop working as much because we tend to spasm and everything tends to feel like it's compressed. Now, if that's the case, those muscles aren't then functioning to be our support muscles. What happens is as we're then moving and as we're doing stuff, the core muscles switch off, they forget, or they become inhibited is probably the more realistic term for them. And then the big muscles start to take over. So now our six-pack muscles and our big back muscles, instead of just now moving my body, they're now having to work to hold my body as well, and that's not their job. So they fatigue a lot quicker, and as they're fatiguing, they'll go into more spasm, and as they go into more spasm and more work and they're working harder, they'll compress even further, and that's where a lot of the problems start to lie. What we're doing is, instead of just moving our muscles and using these muscles to help us then function and using these muscles to help us move, we're actually using these muscles to hold us up. Okay, so I think, you know, a big misunderstanding that we get a lot is that people say, well, I go to F45, I go to the gym, I do training, I'm this, I'm a sports person, my core is fabulous. And really, when we're testing core strength, it's not that great at all. And it really just depends on what you deem is good core strength. So if I'm standing way back here and I've got my hands on my hips, if I'm just doing this and lifting my legs up, I'm using my big hip flexor muscles to do it. Now, if I stand still and I just try and use my core muscles, so I'm trying to stabilize and lift my leg up, it looks quite different, because now what I'm doing is I'm using my core and my deep muscles to stabilize here. I'm using my deep hip flexor muscle to move and to change it, to use that hip flexor to flex. And I have to do that, and I have to think and focus doing that. Otherwise, I'm just using my quads and my deeper hip flexors, and the movement looks a lot different. Same when we're looking at people, if they're lying down and we say do a sit-up, do a crunch, or do a chest lift, they'll tend to use a lot of their muscles and get a lot of compression, and it's a lot of effort. Where if we're saying use your deep muscles, it should be a little bit more like a lift. So it's a lift, and it doesn't come up too far, and I should be working quite hard and everything's shaking, and then I come back down, rather than a crunch and a compress. So how do we know if our core is working, and how do we know what happens? So like I said, there's a lot of debate, and pretty much everyone knows that you want a good core. Everyone knows that we want that support structure around us. Everyone knows that if we've got a good center and everything's working well, we can then function and we can do things. From a sort of personal opinion point of view, if you're here and you're doing heaps and heaps of strength work, and it's very compressive and it's very strength based, you're likely to have a compressed area here, and you're likely to actually have what we would then call a weak core, where your strength, and it doesn't mean that you're not able to plank or anything like that, but it does mean that your strength is being derived from these big global moving muscles, and your actual support muscles that do the control and the support around those are the ones that are a little bit weaker. So you will fatigue in a different way. And this is probably where Pilates and, yoga and that have probably had the upper hand a little bit, in the fact that what we're doing is we're targeting these smaller, deeper posture-based muscles to get them stronger, so that then you can then reach and do things and manage and walk and do the different movements, having a bit more support and structure around you. So if you're thinking about, a dancer or a ballet dancer, or you're watching somebody move, they're very graceful, they can hold and they can lift and they can do things, and, they're holding things and they move very, very well. And it's because they've actually got that motor control. They're able to hold, maintain a posture, and move around while maintaining that posture. So as they're doing something here, they can hold it and change postures and positions. And they can achieve that because they've got a good motor control, so they've got the skills to be able to do that, but they can do it because they've got good core strength and good core stability and good core control. So they're able to manage and hold. And if I'm lifting my leg up, I can hold it. And if I'm stretching my leg out, I can hold it and I can bring it back and I can bring it back. Now, if my core isn't strong enough and it's not working as well, I'll probably try and cheat and use something else to help me, so I can still do that muscle, but it might be that I'm a lot more focused, as opposed to feeling and looking like it feels a bit more easy to do it. And that's what we're looking or when we're looking for quality of movement, we're looking that when you're moving, it actually feels a little bit easier for you to do. It looks a little bit easier for you to move. It looks like it's effortless. Where when you have that big muscles on top, it's a lot more compressive and it's a lot harder to fix, and you're holding to then achieve the movement. So if that kind of makes sense a little bit more for you, that's what we're looking at when we're thinking core strength. We're thinking about, can you support your body? Can your body hold? And then can you move outside of that? Can you support your body? Can you control something? Can you move outside of that? So what factors can affect that? And number one, if you've had back pain, you are generally going to switch muscles off. So if you're in pain, you don't move. If you don't move, things don't function. A bit like if you've had a bad bout of flu, you try and get up out of bed after being in bed a couple of days with a bad bout of flu, and your legs are just like Bambi, everything feels weak, or you go back and try and do your normal walk that you would normally do, and you're a bit out of breath before the end of it. Or, you know, if you play netball or you play sport, you can probably get halfway through the game and go, oh, I'm absolutely stuffed. So it's that kind of thing. The muscle will still fatigue, the core strength fatigues. You have that same thing that happens with the muscle if you haven't used it. It either forgets what it needs to do and it becomes what we call inhibited, or it's weaker and it just takes that a little bit longer to kick back in. Second thing that can happen is that over time, if you are in pain and your muscle is inhibited, it forgets what to do. So if you've had back pain and then you've become anchored and you're in spasm and your muscles are tight, and then you have back pain again and the same thing happens, you then have a core that's forgotten what to do and it doesn't focus for you and it just doesn't switch on. And it's not probably the big misgivings with that is that's something that you actually need help with. That's not something that you then go and decide, I'm going to do boot camp and do planks. That's something where we actually need to go back to basics. So most people start here and they go, I've got a weak core and I'm going to start here. What actually is the weak core needs to start back here. So we need to be doing something a little bit more specific to get that core working again and making sure you know what it is that gets that core working again and gets it active again, because it's a weak muscle that doesn't function and it's very, very weak and it's not got any strength, that's trying to fight against all your postural muscles and compete against rather all your postural muscles. They're able to work and function instead of it. So just be aware of that one. If you've had abdominal surgery, so your core muscles are obviously in the deepness of your stomach. If you've had, from a female point of view, if you've had a pregnancy or if you've had a C-section delivery, and from a male point of view, if you've had abdominal surgery or like a laparotomy where they've actually had an incision through your stomach, sometimes what can happen is you get the muscles and they split. So there's a little bit of what we call a diastasis. And when that happens, it's the actual center section of your stomach. Instead of having your two muscles that sit side by side, which are your six packs, there's actually a gap in there. And that gap means that the muscles aren't coming together at the front. So you have that sort of, and it's typically more like a jelly sort of feel to the musculature of your stomach. It just feels a bit like blancmange, and you know, it's like that mummy tummy that people say it's just lost that tone. So that's typically something that we'd want to check and make sure that actually you do have muscles that are together, that you haven't got that gap, so that tummy split in there. And if there is a tummy split, are the muscles active and they're able to start to come back together? So that's the second sort of part of that. So another thing to be aware of is that as we get weaker core muscles, and as our core muscles aren't working as well as they should do, we also then tend to tuck underneath. So we tend to sort of find that if we're weaker, our pelvic floor starts to get weaker. So typically, you know, we cough or we sneeze and we might cross our legs, or we cough or we sneeze and we think, oh, you know, my bladder doesn't feel safe. I feel like I might lose some pee if I cough or sneeze. Or, you know, you've got a bit of urgency with your toileting habits where you feel that you're fine, and then you go, I've got to go now. There's no warning. You've just got to get to the toilet quite quickly. So that's what we call urgency. So normally with the bladder, we have a bladder that can expand. So say your normal bladder is here and it can expand to 1,000 mils. What happens with your urgency is that because you're weaker, the bladder becomes what we call a bit more active. It's working hard, but it's still quite weak. So instead of it being able to expand that well, and we get like that slow warning that we might need the toilet, yeah, we need the toilet pretty soon, we just get a stretch reflex, I need to go now. And there's none of that real pre-warning that happens. If 1 minute we're fine, the next minute we need to go, and that's what we call urgency. The other thing that happens is we get the upside to that, which is frequency. So we're not able to get that bladder to stretch to that 1,000 mils. So every time it reaches 200, we go, yeah, we need to go. So it's never really getting that big volume of fluid in there. It's just getting repeated small volumes of fluid. So if you tend to have an urgency frequency pattern with your bladder habits, if you also then tend to find you're a little bit weaker if you cough or you sneeze, and if you tend to find you needing to cross your legs, then it's very common that a weak bladder and a weak pelvis, a weak sort of pelvic floor muscles go hand in hand with a weak core. So when we're testing core strength and we're testing pelvic floor, it will generally float hand in hand, and you know they're very, it's, if I rephrase that, it's very uncommon to have a weak pelvic floor and not a weak core. Is probably what I'm trying to say. So you need to be aware that your pelvic floor is very connected to your core strength. What will tend to happen, and what we do tend to see quite a lot with people, if I just come away this way, is if they are weaker with their pelvic floor, they'll tend to tuck under a fair bit. So instead of being in that neutral position, they'll be in that sway position, and they'll tend to have knees a little bit more knocked together. And again, that's more a pattern of, it's harder for you to control. You're a little bit worried about pelvic floor, so you'll tend to tuck under and suck in that way. Unfortunately, that also weakens your pelvic floor more. So it's a case of trying to ascertain what's the best way forward, and what we need to be doing to get both of those things functioning back to normality again. And then the last sort of thing just to be aware of is like we were talking before, posture. If you're in that sort of tucked under posture and you're in that posture where you're already crunched, there's no way for you to be able to access your core strength, because it's inefficient to be able to access it. You need to be able to access it in a more neutral position, and if you're already tucked under, you're already sort of squeezing, you're already compressing, and you're already in that sort of posterior tilt with your pelvis, you then have a pelvic floor that's fighting against a muscle that is weak, but also a core strength muscle that's turned off, and then trying to activate that on top generally makes us a little bit more worse to the pelvic floor. So a weak pelvic floor, tucked under position, and then trying to activate your sort of core muscles on top might mean that you have a lot more downward pressure, which might mean that your core strength and your pelvic floor actually get weaker. And that's a common scenario that we find from women. What they'll say is, you know, I try and do this, but when I go to boot camp, or when I try and do this, or when I try and do sit-ups, it actually has a weakening effect. And that's one of the criticisms that Pilates had a fair few years ago, is that everyone was thinking about sucking it through their belly button, pulling up everything as hard as they can through their pelvic floor. And generally nowadays we probably don't cue that anywhere near. I generally don't cue pelvic floor, and I generally don't cue sucking your belly button back, because most of us are already doing too much of that. And what we actually need to do is find how to activate our core strength, so we don't get the doming, we don't get the tummy that billows out, we get the tummy that gets us flat against our abdominal wall, so the muscles pull in to support us, and then the bigger muscles like your six-pack then can function to move you. Okay, so a quick recap of core strength. Your core strength is not about your six-pack muscle. It's not about how toned or untoned you are. It's about, have you got control around that central portion of your central system, so that would be your diaphragm on top, your pelvic floor underneath. That would be your transversus abdominis, so your stomach wall at the front, and then the muscles at the back would be your multifidus muscles, so the smaller muscles in the spine that work to support you and give you a little bit of height and a bit of structure and control through the spine, rather than the big muscles of your six-pack and your back, long back strap muscles, which push you down and compress you. Things that can affect it would be if you've had back pain before, and if you've had back pain that's ongoing, and if you haven't then rehabilitated that well, where your core is working effectively again, what tends to happen, especially in pain, is that that back becomes inhibited. The second thing that can be an issue is that you overuse those big muscles instead of those posture muscles, so those deep muscles. So we're overusing those big muscles, which cause more compression, and it actually makes our posture and our deep muscles and our core muscles weaker. Another factor that we just discussed is if you've had surgery before, or if you're obviously female and you've had babies, the actual sort of stretch of the abdominal wall can cause a split in the stomach. Same when you've had surgery, it can remain with a split in the stomach. And that can obviously cause an effect where the muscles of the stomach and the core muscles of your TA are weaker. Just a side note on that one as well, this can also happen if you've had quite a rapid weight gain. So if you've been, for one reason or another had a rapid weight gain, you can get a similar effect with that. And then the other thing that we were talking about was pelvic floor. If you tend to have a little bit of a weaker pelvic floor, that can obviously have a link in, or is linked in with having a weak core as well. And also your posture. So if your posture is in that tucked under position and you're here and you're in that posterior tilt of a sway back posture, you're generally a little bit more prone to a weaker core because it's not functional, but also a weaker pelvic floor. So hopefully that will give you a little bit of an insight into how core strength affects back pain. If your core is weaker, you don't have as much support around your spine, which means that your spine will want to compress more, and as it compresses more and as it becomes a bit more active and the muscles activate and compress even further, it can put more pressure on the spine as well. The other side of it is obviously also if you have the opposite effect where you're not moving and you're stiff, you obviously lose the flexibility and mobility, and that plays into what we were talking about yesterday. If you're not mobile and able to move, then you're quite rigid, and as you're rigid, you're in spasm, and as you're in spasm and as you're not moving well, the core isn't able to function and help you. So hopefully that gives you a little bit more insight into it. For tomorrow's talk, we are just going to wrap up and try and put a few of those things together for you and sort of tie it all in so that you've got a little bit of an understanding about how you can then move forward if you have back pain. So if you've been watching these, thank you so much, and hopefully it has been of benefit for you. So take care.